Congestive heart failure, also known as CHF, occurs when the heart is no longer able to pump adequately enough to meet the demands of the body's tissues. Let's examine a case study through SOAP. The S in SOAP stands for subjective, O for objective, A stands for assessment, and the P is for plan. Subjective consists of the patient's history. In this case, the patient's chief complaint is shortness of breath, a cough, feels fatigued, and has chest pressure. The history of the present illness is that the shortness of breath and feeling fatigued has occurred for the past 4 days and has progressively gotten worse. The shortness of breath is worse when lying down and with exertion. Coughing happens throughout the day, but particularly at night. Also, this patient stated that chest pressure started this morning around 6 a.m. The only known current medications being taken is insulin, and there are no known allergies with this patient. This patient is an independent 65-year-old male who lives with his wife. He is not a smoker, has about 1 glass of alcohol a day, and does not consume any drugs including meth, cocaine, and marijuana. His past medical history consists of hypertension, diabetes, and a previous myocardial infarction. The family medical history includes liver failure and other myocardial infarctions. Also, cardiac catheterization and an angioplasty are a part of the patient's surgical history. The objective part of the patient's analysis includes all physical findings. Therefore, this man's skin has no signs of infection or rash. There is no edema present in the extremities. There is a crackling sound coming from the lungs, and his initial vital signs consist of a blood pressure reading of 212/108, heart rate of 120, respirations of 28, temperature of 36.8 degrees Celsius, and a 95% oxygen rate. The assessment consists of all labs, x-rays, and evaluations. This patient has type 2 diabetes mellitus, but it is managed fairly well. An EKG, chest x-ray, CBC, urinalysis, and ABGs were completed. The pH is at 7.4, carbon dioxide level of 22, bicarbonate level of 26, and as previously mentioned, an oxygen level of 95%. An echocardiogram was performed and shows cardiomegaly and decreased cardiac output. The electrolyte levels are abnormal due to the fluid retention. There is an anion gap of 24.3, A liver function test was performed. BUN and creatinine levels were tested. The BNP level is increased, and the blood glucose level is at 122. It was determined that there is left systolic heart failure, and that the pulmonary edema, cough, chest pressure, and shortness of breath were due to the CHF. The plan from here is to modify the patient's diet by restricting fluid and salt intake. Check the blood sugar level every 4 hours, keep the oxygen above 92%, place the patient on diuretics, ACE inhibitors, beta blockers, and aldosterone blockers. Also, monitor the vitals every 4 hours and consider a defibrillator to help maintain the heart in proper rhythm.